Welcome to this product demonstration video of the 12-in-1 saliva drug screening product, the Saliva Confirm Premium saliva drug test. This is currently the most comprehensive saliva drug testing product available in Europe. It gives you individual results for 12 drugs, one of which is alcohol. So the beauty of this is you've got a combined drug and alcohol test in a single procedure. The other big advantage to this one, if you're not familiar with doing saliva testing and you're looking at these large combination saliva tests, and the feature that this one's got built into it is a saliva indicator within the handle. If I just remove that to show you, you will see the standard collection swab on a stick. The saliva has to completely saturate that swab, and as it is presented packaged, that is not as rigid as many of the swabs that we get, but the beauty of this is that once you've got sufficient saliva absorbed into that swab, you will get discoloration or a blind showing on the handle element, this white portion here, that indicates to the tester that adequate saliva volume has been collected to saturate all 12 of the membranes in the saliva drug test. Now, if I just run you through the combinations which are on this panel, you'll see it's a double-sided test, rectangular shaped barrel with blue caps, an indicator for the sample number and the donor, also indicative results interpretation guidance, expiry date and lot numbers on here, and the coding for the drug tests are on the individual membranes embedded into the sides. So on this test you've got AMP amphetamine, COC cocaine, THC for cannabis, OPI for opiates, MET for methamphetamine. The alcohol test strip is a straight colour change pad, and provided with each of these tests is a colour chart for interpretation of your alcohol levels. You've got on the reverse MTD for methadone, PCP for PCP, BZO for benzodiazepines, BUP for buprenorphine, BA barbs for BAR barbs, and OXY for oxycodone. So this is a 12 combination with the alcohol, and to run this test, once it's removed from the foil, the saliva collector is given by the performer of the test to the donor, and what we're going to do in part 2 is just show you how the colour change indicator will indicate that sufficient saliva has been collected. The swab needs to be saturated in saliva in the donor's mouth, nothing having been eaten or smoked, for at least 20 minutes ideally. So in part 2 we'll come back and show you how the indicator of saliva shows when this test is being performed.